Hello, so my name is Rebecca Tullis. I'm going to be talking about my diabetic concept map. My patient, an 84-year-old female, she came into the hospital. She was just there for a day. She got admitted late in the evening, I think 8 o'clock at night around that time, and then she was getting discharged like right before we left for clinical. So very short hospital visit. She came to the hospital. She had chest pain radiating to both of her arms into her armpits, and it was all over her chest. She has a history of coronary artery disease, so she was worried that she was having a heart attack. She was not. I'm so sorry if you hear my dogs. Hazel, get up here. Anyway, my patient has type 2 diabetes, and basically just what that is, the patient has a decrease in beta cells, and so those beta cells aren't being able to get into the cells, and she has a decrease of insulin. So she's taking medication to help not have that insulin resistance and, increase her beta cells to secrete insulin and, all that fun stuff. So she was diagnosed with that. She was diagnosed with coronary artery disease in 2015, and shortly after she was diagnosed with diabetes type 2. So family history of my patient: she is one of 4 siblings. 3 of her siblings have already passed, 1 at a very early age, and then 2 at a fairly early age as well. None of them had children, that she said, because they were just young. It was not health related. It was just like a life happened. Car accident, 1 fell, hit their head, ended up bleeding out, and then the one was very, very young. I believe she said 2 years old whenever he had passed away. So it's just her, and she does have 3 children of herself. She lost 1 child very early age as well. The child had a genetic disease that ended up passing, and so she does have 2 remaining children who she does talk to. Whenever I asked if any of her family had a history of diabetes, she said that she was not aware of her siblings having it. She is not aware of her children having it, and I asked about, do you remember if your mom or your dad had it? And she said no, they also died fairly young. She is 84 years old, so I do think she has a lot of anxiety, honestly, about death. And I think that was a big reason why she was so anxious the entire time she was in the hospital, because they just scared her, and which totally valid. But yes, so my patient, again, type 2 diabetes, had chest pain. It ended up going away very, very quickly whenever she got to the hospital. She did have her troponin was elevated, so they did admit her for observations. Just a little bit of social history about my patient. She did live in assisted living for a while, but she didn't like the assisted living. I don't know the whole backstory about that. I think the daughter really wanted her in there because the daughter does help her, not a lot, but just as she needs it. However, she ended up moving out and she lives on her own, and she does talk to her son and her daughter quite often. Her son and her actually got into an argument the day that she started having chest pain, and she was very, very upset about the argument that they were having. So I'm wondering if her emotions and anxiety and just all of that was causing maybe some of the chest pain and some of the anxiety. I'm not really sure, but just something that I was thinking about. My patient does not smoke or drink, and she does talk to her neighbors often. She lives in a duplex, and so she is able to talk to them, and she called to let them know that she was in the hospital, and I thought that was very sweet that she didn't want them to worry about her. So just a little bit of medical history. She has, again, like I said, coronary artery disease. She does have hypertension, hypothyroidism. She has GERD. type 2 diabetes, and then as well as obesity. She is a little bit overweight. So her BMI 25.5, which they classify that as overweight. It's not too overweight in my opinion. I barely count that as overweight, but medically it technically is. She does attend physical therapy regularly. She had a left hip repair not too long ago, and then she did have a CABG back in May of 2025. So she's been doing cardiac therapy for a while, and she actually just finished that, she said, in January. So she's been regularly getting out and getting active and staying active and just stuff like that, which is great. She does try to follow a heart healthy diet. She does try. She does love to make pumpkin pie. That's something that she makes. She told me weekly that she will make a pumpkin pie. I did try to educate her that, that does have a lot of sugar, and, they are very good and stuff like that. She does use Splenda instead. So that's just something that she thoroughly enjoys. She is aware that it's not great for her diet, and she's talked to her doctor about it, and they've kind of worked it out. So a little bit of assessment findings. Whenever I was talking to my patient, her vital signs were they were all within normal limits. Her blood pressure was 151/77 at 7 a.m., but that was before she had received any of her medication. So that went down after she had gotten her medication, and it was 137/74. So it went down. I took that at 9 o'clock. So it did go down. Everything else, her A1C, they did take that back in November of 2025, and it was 9%. So definitely something that she needs to work on getting down. I didn't ask her a whole lot about her A1C or anything. I looked at that towards the end of the day, and that was one thing that stuck out for me. So I'm curious when they're going to reevaluate that and what that will be, because she did say that she is trying to eat healthy and just do what she can and staying active. One thing about my patient, like I said, she did have a lot of anxiety. She does have nitroglycerin tablets for her chest pain. However, she was very, very anxious about her chest pain that she didn't want to take the nitro. So she ended up calling EMS, and then EMS administered the nitro for her. The nurse, I did witness a lot of patient education whenever it came to that, and it was her first time ever having to do it. So I think she was just very, very nervous about that. Her respiratory assessment was great. She does not wear oxygen at home. Clear lung and heart sounds. I mean, she did have a little bit of exertion whenever she walked to the bathroom, but as soon as she was back, she was totally fine. Her skin was great. There was no abnormal findings that I found. She did have like a little bruise, on her arm, but no wounds, no cuts, anything like that. Warm, good skin turgor, no edema. Her musculoskeletal strength was very equal, 5 out of 5. She very strong actually when she was I wrote this, very strong whenever she was squeezing my hands. She had no problem getting up. She was very independent. She was able to perform her ADLs, brush her teeth, get up, and she did get up, and she wanted to wash her hair. She wanted to take a shower, but because she was on telemetry and she was having some heart issues, they did tell her that she couldn't take a shower. So she was very up and active, and you could tell she was just feeling so much better. Very anxious still about being in the hospital, just because she was concerned about everything that was going on, and her chest pain, and her kids were worried, but they weren't there, and they wanted to know what was happening. And so it was just a lot of the unknown that I think was scaring her. But anyway, her GIGU, everything was great. One thing about her GI, however, great. She wasn't having any difficulty urinating, but I was looking at her labs, and she did have 4+ bacteria, white blood cells, red blood cells in her urinalysis. She did have a very foul odor after she used the bathroom, because when she got up to use the bathroom, I just so happened to be in there, and then I was looking at the color, and I just noticed a very foul smell. And so then I went and I looked to see if they did a urinalysis, because if they didn't, I was going to tell the nurse. No signs of confusion, but just, again, a lot of questions, a lot of repeating. I don't know if it was just because of the unknown, or if it was starting to become a little bit of confusion, because she did ask a lot of questions, not necessarily similar, but in the same aspect. So anyway, yeah, her assessment, very great. The type 2 diabetes, I think often these all go hand in hand, and so it's very good at, like, you know, if somebody has coronary artery disease, often they are going to have diabetes, or they're going to have hyperlipidemia, or they're going to have hypertension. So I wasn't surprised whenever I looked in her chart, and I did find that she had diabetes. Overall, I mean, I think my patient's condition was greatly improved from whenever she first got into the hospital to how she was whenever I came in contact with her, and even whenever she was deciding to leave, or whenever she got discharged to leave. She was very excited to go home and just kind of get back into her element, and she said she was feeling much better. So I was happy that she was able to go home, and that they didn't find anything that she needed to stay. She was not having any issues with after her cabbage, or anything like that. So thank you.